Michael in Crystal Lake, Illinois. Hey, Michael, what's on your mind today?
Yes, thanks so much for taking my call. Appreciate what you do.
Thank you.
My call is about Medicare Advantage. I'm now 73. When I turned 65, I did not do my due diligence. I let my insurance agent handle it, and I was on Medicare Advantage.
Uh-oh.
It's actually not been bad. Listening to you, I tried to switch to regular Social Security, and that was not a problem. But because I needed a supplemental plan to cover things that Medicare did not, I was rejected by the insurance company for pre-existing conditions.
Yeah, they can do that if you're off real Medicare for more than 1 year. 1 year and 1 day.
Yes, but so it's literally impossible for me to switch back to Medicare.
Well, it's not altogether impossible. Ziggy, who's a regular caller into this program, was talking about this on our Hartmann Report Zoom call last Saturday. He has regular Medicare, but he does not bother to buy a Medigap policy. And he's going to have surgery next week, and I don't want to go into the details. I'll let him do that if he ever wants to call in and tell the story. But he's done the math, and the Medigap policy, which would typically cost, around between $2,000 and $4,000 a year, if you'd had it all along, is more expensive than his copays, even with a major. I mean, he's having major surgery in 2 different parts of his body. He's apparently cancer, and even with that, without the Medigap policy, he's still paying less than if he had had Medigap. So I'm not recommending that you not get Medigap. I would never recommend that to anybody. Number one. And number two, just because one company turns you down doesn't mean other companies won't. There's numerous companies out there. Several people have called and talked about Mutual of Omaha, for example, is one of their favorites. The mutual companies are typically owned by their customers as opposed to by their shareholders, although it may or may not be the case with Mutual of Omaha. But that's how it started out. But I'd say shop around, Michael. You might find somebody who will do it.
Well, I did shop around, and it just made no sense. And I guess my point is, and listen, I'm a big fan of everything you do and all that, but we need to make Medicare complete.
I agree.
And not, why is there a donut hole? That makes no sense.
Well, the donut hole is in there because the Southern Democrats in 1965, when Lyndon Johnson pushed this through Congress, who are now Republicans, but the Southern Democrats were just blatant racists, the Strom Thurmonds and Jesse Helmses of the day, and they wanted there to be a barrier for access so that poor black people wouldn't show up in the same hospital with them. And so they put that 20% barrier in there, that 20% hole in Medicare, so that, basically for that reason. I mean, just keep black people out. I mean, that was their rationale, and it's still there. And I'm completely with you. We need to get rid of it. The insurance industry is making billions of dollars a year in profits off that, particularly off people who didn't sign up for Medicare when they first turned 65, instead bought Medicare Advantage and kept it for more than a year and 1 day, at which point, going forward, see, if you sign up for it on the day that you turn 65, they have to give you the same price. Everybody gets the same price. Everybody gets the same coverage. But after 1 year and 1 day, they can do what's called underwriting. They can look at your medical history and give you a really, really high price, or even refuse to sell you a policy altogether. And it sucks. And now you're stuck with Medicare Advantage, where, I mean, United Healthcare is just threw 800,000 people off Medicare Advantage, because as you get older and sicker, they just throw you off the policy.
Right. Well, I don't want to mention any companies, but the company I've been with since I was 65 has actually been pretty darn good. But my point is,
we need to fix the
I can't
system.
leave myself or my family exposed. And it makes, if the Medicare gap was formed in 1965, I don't want to do the math, but it's now 2025. And, that certainly needed to be addressed. But anyway, That was my point. I should have done my due diligence, I should have done my due diligence. My insurance agent was a friend. He didn't do me any favors. I didn't. You know, it's called Medicare Advantage. It's called Medicare to me. It was Medicare. I didn't know.
Oh, the majority, Mark Pocan was talking about how he'll go into a town hall and he'll say, how many of you are on Medicare? And, all the older folks raise their hands. And then he says, how many of you are on Medicare Advantage? And, half of them will have their hands still up. And then he says, how many of you think that Medicare Advantage is Medicare? And most of them keep their hands up. They still think that it's Medicare. They don't realize it's private health insurance that is not regulated by the federal government. And they can screw you, and they do. And I'm glad that you found a company that's treated you well, Michael, and I hope they continue to treat you well as you age, because the day will come when you start getting real expensive for them, and that's when it gets real problematic, because real Medicare will never drop you. But, and when that day comes, you may end up having to go to real Medicare without the Medigap coverage, which still won't be a disaster.
Because I had called Medicare, and what they told me that Medicare Advantage plans are required by law to cover what Medicare covers. And I'll tell you how that came about. I was, a cardiologist suggested a procedure, and that was the only procedure was turned down by Medicare Advantage plan. Mm-hmm. And I called and asked why, and they said it's just not approved for somebody my age. I went to Medicare. They said they would not. They said they would not cover it because it's procedure not approved for someone my age. However, they said Medicare Advantage must cover everything Medicare does. So,
well, it's not true. It's not true. But that's what the law says. You're right.
Yeah.
But the reality is that Medicare, if your doctor says you need a heart procedure, you will get it. If Medicare thinks it's fraudulent or unnecessary, they don't come back to you. They go back to your doctor or to the surgeon or to the hospital or to whoever performed it and said, prove that this is good. And if they can't prove, then they have to pay it back. But you have nothing to do with that. That's invisible to you. Your doctor says you need something, you get it if you're on real Medicare. With Medicare Advantage, everything you do is subject to the insurance company saying yes or no. And 18% of the time, nationwide average, Medicare Advantage turns down people's doctors' recommendations. 18% of the time. The percentage of the time that people on real Medicare have things turned down, zero. Zero. There's not even a mechanism to do it. Although now, starting on January 1st in 6 states, and I recall Arizona is one of them. I don't remember what the other 5 states are. But in 6 states, the Trump administration is going to insert a company between real Medicare and their patients and start doing this pre-clearance thing like Medicare Advantage does. It's a trial run supposed to run for 6 years. So, it's like just crazy crap. I mean, the Republicans just hate Medicare. They hated it in '65. They've hated it ever since. They're doing everything they can to kill it, and this is part of that plan. George W. Bush was the guy who brought us Medicare Advantage in 2006. He invented it, or 2005, invented it out of thin air, and to privatize Medicare, because he campaigned repeatedly. His first campaign for Congress in 1977, George W. Bush, was on privatizing Medicare and Social Security. They will never give up, these Republicans. They will never give up. Michael, I wish you the very best. I'm out of time. I got to run, but thank you. We'll be back.